Hi everyone, welcome back to another episode of UCL Giving Voice podcast. I am Vivian.
And I'm Claire, and we're Year A students studying on the MSc Speech and Language Sciences course. So this is actually the first episode of 2022, so Happy New Year! And in our last episode, as part of our student series, our friends Laura and Chloe interviewed some current students in the SLT course about their unique perspectives of studying here.
Oh yes, if you haven't already, please give it a listen. Claire, can you believe we're already in term 2 of our first year and we're on our 10th week of placement? I'm definitely feeling more and more confident about being a speech therapist now.
Oh, has it been 10 weeks already? My clinical tutor visit is actually next week and I'm quite nervous about it.
I had mine last week and don't worry about it. She was super nice, or our PE practice educator, and our clinical tutors are super supportive.
Oh, that's really nice to hear, actually. So I'm very looking forward to just gaining more experiences in placement and actually getting to practice as an SLT in the future.
Speaking of practicing as a speech therapist, we're starting a new series of podcasts, which consists of 2 episodes about SLTs with international backgrounds, and we will have insights on their experiences.
So today we have actually invited 3 of our SLT friends from Hong Kong. So we have Serena, Kelly, and Nigel. And
Hi.
they all Hi.
Hello.
And
Yeah.
they're all trained and qualified in the UK, actually.
Okay, let's get to know them a little bit more. I think both students and qualified speech therapists will agree we get this question a lot from our family and friends, or even just people who just met us. So, what do we do as a speech therapist? And I wonder, how do you all answer this question about your profession or specialty?
Okay, so I'll start first. So I'm Serena. Hi, everybody. As Vivian and Claire's already said, I'm from Hong Kong. I think as I'm a pediatric speech and language therapist. So what that means is I work in schools. I also work in special needs schools. So I cross over, the mainstream side of things. And I also work with kids who have learning difficulties or more complex needs, such as global developmental delay, Down syndrome, autism with severe language difficulties. And I guess whenever I talk to, my family about what I do, I basically tell them I help kids communicate where they can't. So, for example, if they find talking about, the day-to-day life, they're not able to ask for what they like. For example, they find asking for their favorite toy really hard, or even just saying hello to somebody, they find that really hard. I help them. So that's the simplest, it's my simplest spiel of what I do. Obviously, as speech and language therapist, we do a lot of other things as well. So I also work with kids who have developmental language disorder, which is a difficulty for anyone who's regardless of if you are bilingual or monolingual, you have difficulties with learning and using language. I also work with kids who have, speech sound difficulties, stammering, selective mutism, social communication difficulties. So it's quite a wide range. Anything to do with communication, we're involved. So that's me.
Hiya. So my name's Kelly, and I'm also from Hong Kong. I just graduated quite recently. I graduated last September, and I've worked as an SLT for around 3 months now, and I work in an acute inpatient setting. So a lot of people get really surprised when I told them I work in a rather medical setting, because they thought SLT must be in mainstream school or special needs school. And so my typical day start with case prioritization. So we get new referrals from different wards every day. I work in really all around the hospital, like stroke ward or trauma and orthopedics. I work in geriatrics. I work in general medicine. It's just everywhere. And I discuss my existing caseload with my colleagues. And then we get through the new referrals to see which one are more kind of urgent ones. Let's say if a person is not having anything to eat and drink and they're on IV fluids, we tend to prioritize them because they're not meeting their nutrition and hydration needs. And then I just go and check my patient's case notes to see how they're doing, to see how their chest is, if there are any bilateral crackles or like right-sided consolidation. And then if there's the new referral, I look at their past medical history, if they got a background of dementia or like COPD, that sort of thing. And then I rush to the ward and have a chat with the nursing staff to see how they're doing, what sort of concerns are there. If that's for swallowing, I tend to ask what they've been having. And they usually reply like they're having shepherd's pie or fish pie, that sort of traditional food in hospital setting. And then usually in the morning, they also do their walk round. So I just talk to the doctors as well. And then I see them for assessment. Perhaps it's like a communication assessment. And I tend to hold an informal chat with them to see how they're doing in general. Or like swallowing assessment, like oral motor skills and oral trials. And then I go back to the office, type up my notes, and then make different phone calls to the ward, to like the medical doctors, to consultant, FY1, FY2. And then I have lunch afterwards. And in the afternoon, it's usually my admin time where I do like the GP letter and perhaps give the nursing home a ring because some of my patients got discharged back to nursing home. So that's really my typical day. It's really fast paced sometimes, but I really like it in general.
Hello, so I'm Nigel. I'm from Hong Kong as well. I graduated from University of Sheffield in 2020. So I've been working as an SLT for just over a year now. Similar to Kelly, I started off actually in an acute hospital. So yeah, just to kind of emphasize that the work that we do is very diverse, and we can work in different settings with people of all ages affected by a range of medical and emotional conditions. So in an acute hospital, I worked in acute setting, and I also had the chance to work in some outpatients with patients affected by head and neck cancer who may have undergone radiotherapy or chemoradiotherapy or surgery to remove the tumor. And after that, they could experience communication, voice and swallowing problems. So our role is to provide counseling, provide information prior to medical treatment, as well as during medical treatment, because a lot of them experience trismus or dry mouth, painful swallowing, and sometimes they have trouble with swallowing. They might, food and drinks might go down the wrong way. And also have chance to work in voice once a week. And actually, in my current role, I work mainly with adults with voice problems. So those who may have a hoarse voice or who may have lost their voice, which can be due to a variety of reasons. For example, laryngitis, people who use their voice a lot or use their voice in the wrong way. And it can be quite have considerable impact on individuals, especially those rely on their voice to make a living, for example, teachers or singers or interpreters. So this is mainly what I do now, but there's an area that's really worth mentioning is trans voice and communication therapy. So in my last role, I had a really good opportunity to work in a brand new gender service in Greater Manchester, where my colleagues and I set up this new service and provide a voice and communication intervention to trans and non-binary people. And my typical day used to be a really it's a mixed bag really, because there's quite a few service development projects going on to set up the service, as well as providing intervention groups and assessments, initial appointments to this population. And we also involved student volunteers and as well as therapists, volunteers in our intervention group. So here's a little promotion. If you're interested in gaining experience in this area, Google Indigo Gender Service in Greater Manchester, and you can apply as a volunteer and gain experience in this.
Ooh, that's very interesting. So all of you just work in like completely different settings, and it's also very interesting for like me and Vivian to learn about it more because we're currently in year A and we're more focused on like pediatric settings. So we work in like schools. We've been working in schools so far during our placement. So yeah, so that was very interesting to hear. And okay, so let's take a step back in time, maybe. Can you share your journey about what made you decide to become an SLT? Like any stories or any people that influenced you, any work experiences?
I guess I'll go first. So I think my kind of story is not the most exciting. So I wasn't really influenced by any significant people in my life when I was trying to find a career. So I learned about speech and language therapy really through when I was, finding a degree as you would as you near graduating your high school, your secondary school, and stumbled across speech and language therapy and then learned more about it during my bachelor's degree, which was English language and communication. And I realized that there are people who work with others who find communicating tricky. And as a bilingual person, I've definitely experienced so many moments of, being lost in translation, and just finding that it's like communication is hard when you are placed in a completely new environment, not to mention for those who maybe have medical conditions, or medical conditions that impact on their communication. And then I slowly got to know more about it. For example, I went on work experience with NGOs, so like nonprofit organizations in Hong Kong, such as the Nesbitt Center. They work with people who have learning difficulties by providing them with, vocational training and maybe hoping to support them towards their independence. And I just learned so much more about it, and I fell in love because it's such a mix of, science and linguistics and all of the psychological things behind it. I was just, this is amazing. This is the career I want to be in. And there I am.
And mine is a bit complicated. So I got an elder brother, and he had like significant mental health needs, and compounded with the fact that he got special education needs. And at the time, we are talking about like around 20 years ago, or like 10, around like 15 years ago. There's not much support back home in Hong Kong in terms of SLT. And every single time, I remember when we're seeing the clinical psychologist, it's always my mom who's like engaging in those conversations and detailing all those signs that my brother's displaying. But my brother, like, he could engage in a conversation. It's just like, it's really, really difficult for him to kind of detail all those abstract feelings because they're like higher language function, which he got like special education needs. And it's kind of an issue around cognition and accessing those words, those higher language function, that sort of thing. And then his like mental health got really, really poorly. And I think as long as I like, and then I went into college and I found out more about speech and language, and I found out more about psycholinguistics, and then I did some more research on that, and I feel like, oh, that should be an SLT who should be helping him. And that's one of the reasons, like my brother who got me into this field. And then I actually did a degree in English education. It's like a mixture of like psychology, English literature, and linguistics. And for that degree, I need to do kind of teaching placement. And on my placement, I've seen a lot of people who struggle a lot academically. It's not because they're not intelligent or not smart. It's simply because they just have communication difficulties. Let's say if they're having math problem, they just can't understand the scenario. You get those scenario in the math problem where they tell you, oh, so Daisy is going to the supermarket and then they're going to get a dozen of eggs. And they just don't know what it doesn't mean. And that's why they get the problem wrong. And they feel really kind of frustrated. And I don't think there's adequate support for them. And kind of these reasons make me want to study SLT. And I've taken a gap year, same as like what Serena mentioned before. I work in Nesbitt for a year and I met like really amazing people there. And my supervisor, she's like fabulous. She introduced me to like Makaton, different AC systems, and I work with PMLD population. That's the most fascinating experience that I've ever had. And I decided to take a step forward and to pursue this profession. So that's pretty much my story.
Yeah, like fun story. I actually got inspired to be a speech therapist because I was a summer intern at Nesbitt Center. So that's actually how I met Nigel and Kelly here. So I'm actually really surprised to hear that Serena is also in Nesbitt Center.
That's so interesting. It's like a common theme for all of us. That's amazing.
Yes, it is a great place to nurture like interest, and they just have fantastic like support towards like different fields to help people with ASD. So
should probably
they also, did you know they also have they have a cafe now that's staffed by service users who go to Nesbitt Center. I've been meaning to go back for so long. So if you're listening to this podcast and you happen to be in Hong Kong, please go visit Nes 8 because it's an amazing venture.
It's amazing. It's absolutely like rewarding. It's like, it's a very, very rewarding experience, like working there, meeting all of you. Like it's the most amazing experience.
It was great to work with service users and kind of help them to achieve their full potential and reach their goals despite their difficulties. So I think my journey to SLT is not very straightforward either. And I'm glad I'm in this profession because as Serena and Kelly mentioned, that the kind of main thing that we do is to help people overcome their difficulties and to improve their quality of life. So I'm really inspired by this feature in speech therapy. I actually first started at uni studying French and linguistics, because I've been really interested in languages since I was young. But after studying at uni, I realized it was a bit too challenging for me because both English and French is my first language. So compared to other native English speakers, I feel that I'm a bit more disadvantaged in terms of doing it French at university level. So I kind of was rethinking about my career path, about what I wanted to do, and I wanted to do well in it. So I was thinking something more practical for myself. So I was talking to a friend back in Hong Kong, and actually, she was actually she used to be my English tutor back in Hong Kong, teaching me English when I was young. And she encouraged me to look into speech and language therapy. And she actually mentioned that to me many years ago when I was a little kid. But at that time, I think I was not really understanding what she was saying and why she was recommending speech therapy to me when I was 10 or 11 years old. I was still very much into kind of learning English and French at the moment. And then I started to do some research, looking at Wikipedia, looking at websites about what speech therapists do. And I was pretty amazed by the range of areas that we can work in and the different people that we can work with. So including speech, swallowing, and even working with trans people with their voices. So I immediately think, that this is the right career path for me.
Very, very interesting. Thank you all for sharing your experiences as well. And then it was so happy and so cool to hear all of you and all of your experiences here. Claire, actually, how did you get into SLT?
So I think mine was kind of like somewhat straightforward, but also not really. So I had like this profession at the back of my mind for quite a few years before I went to university. So I think one of my friend's parents was an SLT, and so I heard about that profession. I kind of knew what they did, but I wasn't really like researching about it or anything. And then when I was applying for university, I actually thought about like either SLT or psychology. So I was torn between these two courses. But then because I wasn't really sure about SLT yet, and I thought like SLT was a very like you needed to, that was like the only pathway after university if you study SLT is to become an SLT, whereas I felt like psychology had like broader options. So I kind of just went for that option instead, and I did psychology and language sciences in UCL, which is kind of similar to linguistics, but it's more focused on psychological, like child development, like cognitive development, language and the brain and all of that. And I think I was really grateful for that course because I learned more about child language development and the interaction between psychology and linguistics. And we also had a placement during second year at like an early year setting. So it could be like in nursery or like a primary school where we got to observe children just like at school, and we wrote like a report about their language development and like according to their milestones and everything. And I think in that setting, I was able to also like see how SLTs work at school, and I found that it was very inspiring, and I thought they were really cool. And that's how I kind of found out about like SLT, and yeah, and so I just applied for the MSc program, and I'm here now.
Yay! Very nice to meet you. So actually, for audience out there, you might be wondering, so all of us here actually have backgrounds in linguistics, psychology, or we had like language as our bachelor degree. But that's actually one of the misconceptions about being a speech therapist, that you actually have to have a psychology or linguistics degree during your undergraduate in order to be one. So here leads on the next activity that we have for all of you. Can you actually share with us one label or misconception that people have for you as a speech therapist? So how have you addressed it, or what is your opinion on this label? So I mentioned one just now, and I actually have another one which I think might relate to all of us here. So when I was growing up, I was told like being a speech therapist or even speaking English, we should strip away that Chinese accent of ours and actually be more American or British with our accent. And actually, fun fact, I still can't tell them apart.
Oh, really?
Yes. So, Claire, what do you think about this?
Yeah, I definitely agree with that. I've had people tell me that if I want to practice in the UK, I have to have like a standard like SSB accent, and just like not suppress, but maybe mask my Chinese accent, even though Cantonese is my first language. And so I guess that was also one of the factors that kind of put me off from applying to SLT in the first place. But I'm glad I pushed through it, and I'm still here now. Yeah, so have any of you come across any like similar misconceptions or just like general misconceptions about SLT?
I think the accent thing, it's a really, really big thing. Like, because I've once told by my friend, she's like, "Are you sure you want to do your kind of speech and language therapy degree here in the UK? Because, yeah, they speak English, and English is not your first language. Yeah, it's simply about this first language thing that everyone thinks that, oh, it's impossible for you to practice in the UK. But I mean, a lot of people here, especially in London, they come from kind of a multicultural background. And I think being a bilingual is actually an advantage, because like even when I'm on board, I might get some patients speaking Cantonese, which it comes in really handy for me to do the translation and to do like the communication assessment and everything. Whereas if I only got like English as my first language, I just couldn't possibly do all these things. And I think the accent thing, it's just, yeah, it doesn't seem like a valid point for me, because even within the UK, you get Northerners who speak in a different accent, or even people from Ireland who speak in an Irish accent. And it's these kind of like, different opinions about the accent that sometimes just really gets me frustrated.
Yeah, I think the accent thing is used to be one of my concerns as well, as English is not my first language, but like when I kind of started studying and kind of learning how to work as a speech therapist in placements, I realized that there's so many accents in the UK. So there's no one, British accent. And it's become apparent that people are trying to celebrate diversity in terms of languages, various accents, cultures. And I think going back to what Vivian first said about the accent or language thing, I think I used to have a misconception about speech therapists. They must speak with really good pronunciation and excellent enunciation skills. And I think I got this misconception when I met preacher at the church who used to be a speech therapist, and she really pronounced her words really precisely, and it's really good on the ear. And then I just thought, oh, do all speech therapists speak like that? Do you need to speak like that in order to study that or be good at speech therapy? Of course it's not, but it was an interesting experience for me.
Yeah, I think for the accent thing, I reflected on this actually, and I realized that it might be a bias that I have for myself, personally speaking, because at work I do have a British accent, but when I talk to other people, or let's say I'm talking to someone who speaks with an American accent, my accent just changes completely. It drives my friends mad because I sound completely different depending on who I talk to. But it's in my mind, I always have this misconception and bias as well that it makes my life easier, quote unquote easier, to speak with a British accent, because people just seem to understand you a little bit better. But I'm working on it. Like, I've worked as a speech and language therapist for maybe 4 years now. I'm still working on it. So I guess you can say that the misconception is not only still kind of entrenched in some people, but also, as Nigel was saying, there's a really big movement going on with diversity and being inclusive of different cultures, and accents is a really big part of it. And I think for a speech and language therapist, everybody, no matter if you're monolingual, bilingual, whichever country you're from, you have to communicate, and communication is way more than just the way you speak. It's the sentences, the vocabulary, and all of that, your voice and everything. So accent, it's as Kelly said as well, even within the UK, there's so many accents already, and it should be, the last thing you think of, really. So I think that's a really good misconception to think about. Another one of mine is I always hear people tell me, whenever I tell them I'm a speech and language therapist, oh, I need to be careful with the way I speak to you because you're going to look at my pronunciation. And I'm like, I'm not here to correct your pronunciation. It's way more than that. But I wonder if you guys have heard of that before.
I actually have, yeah, because like some of my friends always say, oh, you're a speech therapist, you should like know how to speak better, or like, because like when they're trying to like formulate sentences to like send out to like other people, maybe they'll ask me for advice. They feel like I would know better because I'm a speech therapist. I think in some ways it might be true because I might be able to think about like the pragmatics a bit more and structure it a bit better. But I think it's also like a misconception because like the area of SLT is really broad, and it's not just about like speech or accents or whatever. And I think also what Serena just said, some people think that being an SLT and you're also involved in like accent modification, which I think is also a common misconception. What about you, Vivian?
For me, actually, I think being a linguist before in bachelor degree and right now being a speech therapist, I think everyone thinks we teach English, but to be honest, English is not the only language out there, and we actually like work with clients with not just English as their language, as their only home languages. We actually work with a lot of bilingual clients. I actually have quite a few like bilingual caseloads on my placements myself. So we don't actually teach English. There's actually a separate degree for it. But we as Claire said, I guess we as speech therapists, we're made to be more aware of people's language structure and how they will produce their articulations. And through our profession, we do find more structured ways to show them, to demonstrate, to model how language generally works. So I guess that's how I take on this.
Yeah, when I'm working in hospital, I got some kind of weird referrals for bilingual patients where they have English as their second language and then find it really difficult to when doctors are speaking to them in their second language, like which is English. And I just told the doctors, that's not like a communication issue, if it makes sense. Because that person, I've got the interpreter for communication screen, and that person's like absolutely fine in his first language. It's simply just a language barrier because that person might speak like Punjabi, or that person is a Romanian. They don't really speak much English. Yeah, so I think that's the thing, like to differentiate if that's a receptive, expressive language thing or cognitive communication thing, or simply just L1 and L2 issue. Yeah, and another misconception that I get is around the title, like speech and language therapist, because I do a lot of swallowing and dysphagia stuff. And people are like, why are you doing that? You are supposed to teach people how to speak. You aren't there to assess their swallowing and to comment on the swallow function or dysphagia. Yeah, so I think quite recently there's a push for the change in title. I think that's happening in the States, but yeah, it just dies down now. I'm not sure where it goes right now, but yeah, a lot of people just get that misconception where you only work in schools, you work with children to treat their language problem, that's it.
It's a heated topic about changing the title of profession because there isn't a word that encompasses like the wide range of work that we do. So you could say we are communication swallowing therapists, but that doesn't really necessarily capture all the things that we do necessarily. So and I think another thing that I noticed is people, when they meet people who are speech therapists, they'll say, oh, do you work with people with stammer then? So this is such a big thing with people, just have the conception that, oh, we only or mainly work with people with a stammer, but we do so much more than that. And I think it's going forward, it's important that we kind of raise awareness of the range of areas that we study and work in to let people know there are other things that we do and make an impact in.
Yeah, I think another thing about addressing, all of these misconceptions is like not only raising awareness, but also just talking to, I personally start with my own circle. So people around me seem to have a better understanding of what speech and language therapy is because I just talk nonstop about it. It's like, it's not just stammering or it's not just accent modification. We do so much more. But starting within our own circle, and then hopefully there's a kind of word of mouth effect that people will just tell each other what speech and language therapy actually is, what do we do, and how we are actually a way more, varied profession than we actually than we seem to be. Yeah.
Mm-hmm. I do agree because in order to address the misconceptions, the best way to do it is actually to raise awareness from ourselves and actually to tell more people about it. And I generally find like when I tell people I will be a speech therapist, people will have a blank face on. They will not know what I'm talking about. They'll probably, because of the title speech therapist, probably think something related to speech only.
Yeah.
But that's not true. But generally, I think they actually have an interest to know more about it. And whenever I hear misconceptions towards what I'll be doing, I will take that opportunity and just let them know in a really fun and friendly way, non-invasive. And I will tell them like what our job is like and what do you typically will see us doing. And I think if each of us make like a small step, together we'll actually make a big step. And you will never know, 10 years from now, we'll actually know more about speech therapy than we will know now.
Yeah, I feel
Here's
like
the flag.
yeah, it's a like really good thing to start small and just from like your family and friends and your close circle of friends. I find that I'm always like ready to explain about what I study and like speech and language therapy in general whenever I tell people that I do speech therapy. Like I've already expected the question of like what a speech and language therapist is. And I always like give like the same general answer of how like it helps with communication with like all different kinds of like people, and no matter their age or medical condition, whether they have a medical condition or not, and it's not just speech. So I think we're taking like really good small but good steps towards raising awareness. So actually speaking of raising awareness, so we're all from Hong Kong, and we're all bilingual, and so we're East Asian SLTs. So from a multicultural background in a multicultural city like London, have you come across any like challenges, or do you think it's actually an advantage? As like Kelly just mentioned, sometimes you get like Cantonese speakers in the hospital, and it's really nice because you can do assessments yourself and you don't need an interpreter because that's your first language. So yeah, do any of you have like any similar kinds of experiences or reflections about this?
I think one of the biggest advantages that I know of is because we're bilingual and we're working in a country of our second language, I'm assuming, is that we implicitly understand language barriers straight off the bat. So whenever we get a new referral, let's say we know that the patient has a different home language than English, immediately we'll know, okay, we need to support their first language so that they can understand what we're trying to say, so that they can understand what kind of service we want to offer them. And also, we are, personally speaking, I am more aware of cultural differences because like from a Chinese background, I know that there are underlying misconceptions of what different conditions are. And so when I go into that conversation, I will be a little bit more prepared on, trying to figure out, have those conversations about what the clients are actually thinking about. For giving you an example, Chinese families, they generally find autistic diagnosis a bit of a stigma. And so I work with a lot of children who are autistic. And so talking to the families, I understand that, okay, we need to start off from where's the family coming from with their understanding of what the diagnosis is, what their families are thinking about. Are they with any other family members within the country? Do we need to work on more education around that? And it becomes really easy for us to think about this, I feel, because we come from a different cultural background. And so it just becomes really easy to go into that mindset straight away.
And I think aside from that, like making use of my multicultural background to be kind of icebreaker with my patients, because usually, especially right now, you're having your full PPE and you're having your FFP3. It just looks really, really weird when you're just telling, oh, can I just feel your swallow? And you place your hand on someone's neck. Just comes in really, really awkward. And sometimes it can be quite kind of invasive to some patients. And I tend to have an informal chat with them where I just talk about where I'm from, because I'm just not from here. And it's sort of interesting because I've been I've lived in Vancouver for quite a while with my family, and I talk about that, and people might comment on my accent again, like, oh, you don't really have a British accent, but I can't really tell where you are. That sort of thing. That's really good when you want to build rapport with your patients.
Yeah, I resonate with what your experiences are. And I think that there are definitely both benefits and challenges. And benefits, I think, yeah, I agree with what you said, to be able to have that implicit insight, to have that insight into the cultural differences and experiences that patients have when they are from a culturally diverse background. So I'm from Hong Kong, bilingual, and I'm gay, and I live with anxiety as well. So I think these kind of characteristics have given me the kind of ability to really understand my service users who may be LGBT, or who may have a mental health condition, to help to work with them in a culturally sensitive manner, and to be able to relate to their experiences as well, and to build that therapeutic alliance in the therapy room. So for example, I remember I worked with a trans service user who is from a mixed background, so both from Germany and a side of families from China. And we talked about the kind of cultural differences in gender perception, and that being the Chinese perception of gender can be more, it's can be quite different from the European point of view. So it's really good to be able to share that conversation and point of view in the therapy room. But I think one of the challenges for me is to, I feel the need to fit in somehow with the dominantly white society and profession, and coming from a multicultural background, I don't seem to be an expert in British culture yet, although I've been living in the UK for quite a while now, for nearly 10 years, but I was in boarding school and went to university and now working, but I still feel I'm kind of living in between cultures. So that can be quite, give me some uncertainty, and I can feel quite unsettled as well when I interact with white British people especially. But I think it's also a chance for me to learn from my service users, whether they're white, whether they are mixed, have different cultural backgrounds, is to kind of treat them as the only expert of their lived experience, and to listen to them and see what they want rather than what I think is best for them.
No, I totally agree with what Nigel has said, because I always have this dilemma of whether if I should just integrate and learn more about British culture, or I should just just be myself, or because there's always this pressure around fitting in. I think especially sometimes in Chinese culture, to integrate into the society if you're in that country, and so I definitely experienced this dilemma, and I'm still going through that, and thought about maybe finding a balance in between. Yeah, what do you think, Serena?
Yeah, I was gonna say the same, that reflecting on kind of my experience, with my accent and all of that, I do feel that it's part of, trying to fit in and trying to, be similar to other people. It's really funny that I had one of my families, we always talked on the phone, and it was just before, the pandemic, when telehealth started. And the family actually thought I was had blonde hair, blue eyes. And I was like, was my accent that great that actually you thought I was fully British and Caucasian? And so it was, so I guess in some way I managed to fit in quite well, but at the same time, I do definitely resonate with Nigel a lot, that I feel in between cultures all the time, because we're still quite a minority here, and especially within the speech therapy profession. I remember when I was on my course, we had 3 Asians, and that's it. And everybody else was out of the whole cohort, we had maybe a fifth or a quarter of us who were international students. I don't know how you guys are finding it. Maybe it's still quite a small population. Obviously, with more cohorts coming in, our representation is growing, but it's still quite a minority, and it does feel like I'm between cultures all the time, because the majority is like, the white British culture.
Absolutely, because in my cohort, I study in Essex, and there's only me as an East Asian, and there's another international student, but that's the only two of us in there. And I'm just constantly trying to fit in. And if I feel like I can't, I'm just like getting really frustrated. And you know what? Like, I think during my second year, I'm like, okay, I'm not going to constantly fit in, because all my friends are like, just be yourself, like be who you are. And it's not like you're not trying to fit in to trying to have people accommodate your needs, but you're actively trying, and that's enough. And sometimes your kind of cultural differences, it's like what I've mentioned earlier, it's kind of ice-breaking thing. It just make people more interested in your life, and can easily build rapport or like start a conversation with people with that sort of like cultural differences.
I think also it's important to, I definitely agree, it's important to continue to be yourself, because part of us being here, we are representing, the smaller population of East Asians, speech and language therapists for, the future generations. And it's really important for us to, have our voices heard. And also, but with us being open-minded, we are kind of, I guess, being a role model to other people, that we're open to your culture and we're asking questions about your cultures, and we cannot just have that cultural exchange as you were doing with your rapport building, instead of just kind of hiding and suppressing our own kind of backgrounds, because we might, for whatever reason, we might feel like, oh, maybe they won't understand this, or maybe they might have different perspectives of what it should be. But by us being here, we're studying or we've already graduated, it means that we are allowed to be here. We can be here, and we should own it and be proud of, who we are, and just continue to be confident with that, I guess.
Yeah, absolutely. Just be, I think like the key word here is like be open-minded and be comfortable and at ease with yourself, who you are, really.
And be your authentic self, and hopefully we can influence next generation of speech therapists, especially those from Asian or East Asian backgrounds, to join our workforce. And I imagine with the kind of another immigration wave from Hong Kong because of the new British National Overseas Visa, I believe more Hong Kong people will come and live, and we can be a role model to those who are interested in healthcare.
Yeah, so on this note, do any of you have any like social media pages or campaigns that you recommend about like raising cultural awareness or like East Asian representation about SLT, or just SLT awareness in general?
You go first.
Okay, yeah, I think definitely I was gonna say Twitter, because I haven't started using it until I think in my last year of uni, and I find that really, really useful and interesting to be able to connect with other SLTs in different areas, but also those who share similar backgrounds as I do. For example, those who are from Hong Kong or culturally diverse people, and to be able to share similar experiences and or share kind of clinical information for continuing professional development is a really kind of precious tool to have. And we can definitely do a lot of kind of tweets about our kind of SLT life from our perspective to raise awareness and be heard in the profession.
Yeah, that's what I was trying to say. Like Twitter, it's like a really good tool in terms of like if you're looking for clinical information, like evidence-based, most recent CPD activity, or East Asian SLT. There are a lot of things going on Twitter, so I highly recommend you to get on Twitter.
Yeah. So I think Vivian and I are also trying to get onto Twitter, because I we were part of the comms team, so the communications team in Giving Voice, and I actually managed the Giving Voice Twitter account. And so when I first got onto the account, I was so surprised by like the vast amount of like information and like SLT evidence and like just SLT sharing their experiences in general on there. And I think it's definitely something we would like to explore.
Yeah, there's specific hashtags for SLTs and SLT2B. They literally spell it SLT with number 2 and then B. And those are, your starting point, I would say, to follow. I don't think we have a particular group, for East Asian speech and language therapists. Maybe we should make one. But also, I guess if you do want to follow specific people, you're very welcome to go on my Twitter account. I'm SLT Serena Lo on there, SERENALO. And I do follow quite a few, East Asian speech and language therapists. Nigel is on there. Kelly, I don't know your handle yet, but I will follow you from after this podcast.
My handle is Kelly Speechy. So it's KELLY and then Speechy. Yeah.
Oh, cute, so cute.
And I've actually met another East Asian SLT just through Twitter, and her name's Jennifer. I'm not sure what's her Twitter handle, but yeah, she's amazing and she's doing a lot of stuff about LGBTQ as well. So if you manage to find her Twitter handle, just follow her and I'm sure she'll follow you back.
Yeah. And it's really exciting as well to see that we are, getting involved in quite a wide variety of areas. There's this speech therapist who I follow, and I also participate in her journal club as well. She's called, properly speaking, she's called Lam Wing Yee, I think, Lam Wing Yee. But on her social media, she's called Wing Yee Lam. And she's in a more senior role, which for me is really exciting to see, because firstly, we're minority, and it's really exciting to see a representation of us in a more senior role. And she's also, as I said, a lead in the Autism Journal Club. And I think it's just so exciting that she's doing so many things and such an active, role model within the community. And so I follow her quite a lot. And also my partner in crime. So she's my kind of colleague, we studied together. She's called Claudia Kate Young. She's also originally from Hong Kong, but she's like spent some time in Canada as well. She posts a lot on Instagram and Twitter about acute and stroke speech and language therapy related things. She's a great teacher in all things acute. And so I would, if you are looking for, resources, tips and advice on how to, expand on your stroke knowledge, go follow her. And yeah, I'd also like to plug in my own kind of ST Links thing, because Kate and I have actually started this venture with we call it Speech Therapist Links, shortened to ST Links, which we're basically a community, and we're trying to raise awareness of speech and language therapy. We provide support into getting into the career, such as mentoring and advice sessions. We also do lots of events on clinical discussions and advocating for clients as well. So if you are interested, please do give us a follow. Our handles are Speech Therapist Links or ST_links on Twitter. And yeah, very happy to meet new people.
Ooh, so plenty of Twitter and Instagram handles to follow.
I think another one step to do is to follow us, UCL Giving Voice, on Instagram and Twitter. And I'm sure we'll be forwarding a lot of exciting information. Follow up this podcast. So we'll also tag our guests here today. So we'll have Nigel, Kelly, and Serena's profile tagged along.
Yeah. Sorry, I just remembered one last handle that's really, really important to follow, which is SLTs of color. So they are a group of a few speech therapists who are advocating for, as the handle suggests, SLTs of color. So I think they promote, BAME, so Black, Asian, and minority ethnicities. I hope I got that right. Therapists who work in the UK, and they always share really interesting stories about SLTs of color who are getting into the profession or have already been in the profession for a while. They also have a podcast which discusses really interesting topics, such as some of the things that we talked about today, like misconceptions, and also how hard or easy is it to get into the profession as like a BAME ethnicity, and loads more. Like, I would definitely recommend everybody to check them out.
So thanks for everyone telling us so much new things and so many new interesting facts and misconceptions and your opinions, and you guys really widen our perspective towards what we will be expecting for us in the near future. It's actually going to happen very, very soon, sooner than we thought. So here's a cool cultural exchange moment over the podcast and our listeners. Next week, 1st of February, is actually the Lunar New Year for us Chinese. So we do like to celebrate it and as a family, but because we couldn't be back in Hong Kong this year because we're working and studying, but we still like to pitch in our New Year's greetings. And I can start. My word is man si yu yi. So this means I hope everyone, when you encounter anything in your life, you sail through it really smoothly and everything will go well for you this year and your future for sure.
So my word is bo bo go sing, which I think kind of translates to you will be able to improve, or at least like have a step up in like every step you take, if that makes sense. So it could be in terms of like academics, career, health, or just anything in life. So I think that's a really like nice and general greetings message.
So mine is 龍馬精神. So I suppose in English it's more like re-energize, or like kind of vigorous spirit of the dragon and the horse, I suppose.
I think speaking of health, it's mine is 身體健康, which simply means wish you the good health, no matter, because especially we are during the pandemic now, so it's extra important that we take good care of ourselves.
Yeah. And last but not least, mine is 心想事成, which basically means whatever your heart wishes for, we'll wish that it will come true.
Lovely greeting messages, and it really hits close to home. So this actually marks the end of our episode. So thank you all for listening, and remember to tune into our next episode, which is also part of our international series, where we'll be interviewing international SLTs from abroad. And yeah, so
we wish you all a very prosperous year.
Yay!
新年快樂